My name is Dr. Douah, Remi Douah, R-E-M-I, and last name is Douah, D-O-U-A-H.
Mm-hmm.
And I'm originally from the Ivory Coast, West Africa, which used to be a French colony. So if you hear a resemblance of French in my accents, it has a result of that interaction. Having said that, I look at my journey um, in such a way that it's been a collage of experiences or a buffet of experiences, if I may explain that. Let me unpack that for a minute. Um, I did work for the American Embassy, American Cultural Center when I was in the Ivory Coast, and I was an interpreter for people coming to do research in the country. And my goal was basically to educate them about the cultural implication of their research. For example, there was a situation where a researcher came, and the researcher was interested in looking at child mortality in the northern part of the country. And that was way back in 1982. So that gives you a sense of my little age. And so what happened that I had a program where I will now, today they call it cross-cultural communication. But back then for me, it was common sense. It was a program whereby if you wanted to do research in the country, I will have kind of to coach you as to understanding the cultural norms so that you can avoid the faux pas and move on with your research, right? So one day I got a call, and there was a researcher who was struggling in getting her research done. And so upon investigation, I drove to her location in the northern part of the country to realize that she had used a fabric, like a cloth, for her window, and that cloth in a particular region was basically considered something that prostitutes would use. Are you with me?
Yes.
So, or it looked like not necessarily prostitute, but it looks like it was kind of like an undergarment.
Mm-hmm.
So women will wear a cloth and a cloth and a cloth. There's a layer of clothing that goes on
Yes.
before a person goes out. It's just like it was wearing your underwear.
Mm-hmm.
So having a cloth that was extremely beautiful, but it was considered an undergarment for women. And women of attitude will just wear it as opposed to covering up. So that was rule number one. So I walked into the house, and there were two of us, American researcher and myself. And so my first reaction was, why did she choose this specific fabric to decorate her apartment? And why is that no one was participating in her research, especially women, given the fact that it was maternal health issue that she was dealing with? And it turned out that in the community, people look at her as a prostitute, that she was running a brothel, because the fabric that was outside through the windows were, what fabric that was considered women basically exposing women undergarment, right? And the second thing was also that a lot of men do go into her apartment more so than women. So two guys like me and my colleague walking into her apartment, for the community it was like men going to have a good time. When the society was segregated by women and men, and interaction was kind of different. So in a nutshell, what I'm trying to get at was the fact that I never had the chance to interact with women, with researcher, to break it down for her how does a community function. Movement is important. Choosing a piece of clothing to decorate your apartment is important. If you don't know what you're choosing, you send the wrong signal. So in order to solve the problem, I had to call my mother at the time, and I said, "What's going on here? This is a situation that I'm dealing with." And she said, "Well, I think we need to introduce her to the women leaders in the community so she can start building the trust. And then eventually we need to take down those curtains, you know, that resembles women's underwear. And then, so there were a lot of things that we needed to do, and we were able to do that. But I had to work with my mother,
Mm-hmm.
and my mother and I are very close still to these days. And the point I'm making is that it's important for us as public health practitioners. Now moving forward, I came to the U.S. with a Fulbright scholarship to do my degrees at Michigan State University, and then and eventually a PhD at University of Minnesota in UX design, UN Center, human factors, all those things, and then a master's in public health. But I was more focusing on pandemic and emergency preparedness.
Mm-hmm.
And my company does this work today, and we'll talk about it later. And so to sum up what you were saying earlier prior to this recording is that we have a lot of work to do, and both from the country that are receiving us, and I say us as being educated in the West, and what's going on the ground. Um, and as long as the country itself um, doesn't live up to its obligation to its people, there's not much we can do. It takes two to tango because people have done this work before we came. And when you look at the reservoir of knowledge coming from women in those communities, I mean, it's equivalent even more than 25,000 PhDs coming from Yale or Harvard. They survive whatever you call it. They don't have the Mayo Clinic to deliver the babies or to do research. They raise us,
Yes.
and we are as gorgeous as we could be.
Mm-hmm.
You know what I'm saying? With the yam or the jerk chicken we ate,
Mm-hmm.
we are fabulous, right?
Yes.
So on a more serious note, I think we have a lot to do, and I've engaged in international research